Minister, I welcome the National Human Rights Strategy for Disabled People 2025 to 2030. But you and I know that the road from here to Mayo is paved with good intentions and unimplemented strategies, many of them that were outlined here. The subsequent action plan and the implementation of that action plan will be the test of whether this will bring about genuine change or whether it's just another collection of words. The fact is that your government is breaking the law, as Ciara Darmody continues to point out again and again in relation to the assessment of needs. The tragic and avoidable passing of Harvey Morrison Skerritt over the summer must bring an end to the neglect of children with significant medical needs within this state. My sincere condolences to his parents Gillian and Stephen, and my deepest gratitude to them for the campaign they are leading to save the lives of other children who wait for operations. I fully support their pursuit of a full independent statutory inquiry. Mikey Henry from Mayo is one of these young people who has experienced the consequences of failure of care within Children's Health Ireland. Mikey Henry's story has been raised by myself and by others in this House previously. He is 17 years of age. When his parents first tried to access an operation for Mikey for scoliosis in 2022, the curve in his spine was 82 degrees. This week, the curve on his spine is 130 degrees. Mikey's scoliosis has deteriorated to the point that it has damaged his lungs and left him struggling to breathe on his own, requiring oxygen during the day and a mask at night to breathe. Despite promises in 2017 from the Taoiseach and then Minister for Health, Simon Harris, that by the end of the year no child would have to wait more than 4 months for scoliosis surgery. This is evident not in the reality for families up and down this country. In the Irish Independent just this morning, Mary Regan reported that the number of children waiting for spinal surgery continues to rise. Right now there are 135 children on the waiting list, an increase of 108 since the start of the year. Only 7 children have received surgery abroad since the previous Minister for Health instructed the HSE to send any child waiting more than 4 months for surgery to the UK or to New York to receive their life-saving treatment. We know some children are not medically fit to travel as their scoliosis has deteriorated. Last week, when I spoke to Harvey's mum Gillian, I asked her what immediate steps need to be taken to ensure no other lives were lost. She outlined 2 very practical immediate measures. The first one was insourcing. Why are we not bringing in consultants and surgeons from abroad to carry out these life-saving surgeries and operations as a matter of urgency? The second one was the ring-fencing of a small section of private hospitals to carry out surgeries for non-complex patients, thereby freeing up public hospitals for the more complex surgeries where multiple of treatments are required. I ask that this House be updated on a weekly basis until all the children on the waiting list have received their life-saving surgeries. If we're not about saving lives here, what are we about, Minister? I also want to raise the necessity of Mikey and other children and young adults to be provided with suitable transport that can carry the oxygen tanks that they now need to meet the needs of the family and of the child with scoliosis that has been failed over and over again in so many ways. What kind of stupid bureaucracy denies these children and these families something as basic as transport? Minister, this has to be sorted out. This is the first day back of this stall. If we cannot save the lives of these children, what are we doing? We absolutely have to do this, and we have to do everything possible, and we have to have accountability. We didn't have accountability for Harvey, but we need accountability for the other children who are waiting.